Okay, class, welcome to week 3. This is Kendra Anderson, your instructor for Fundamentals of Nursing. I hope everything so far has gone really well. This week we're going to cover two kind of different topics, and so I'm actually going to give you guys two videos, and here's the first one. So the first thing we're going to cover is health and wellness. This is going to be found in chapter 6. This is a big topic, you guys. There's a lot of things to understand about it, but the chapter is not actually that long, so I really encourage you, please read this chapter more than once. Make sure that when you're doing your reading, you are reading all the boxes and practice questions and everything that it has for you. So we're going to go over the objectives for chapter 6. So you're going to want to be able to explain how Healthy People guides public health goals for Americans, discuss how individuals define health, discuss the health belief, health promotion, basic human needs, and holistic health models to understand the relationship between patients' attitudes towards health and health practices, identify variables influencing health, health beliefs, and health practices, discuss health promotion, health education, and illness prevention activities, compare the 3 levels of prevention, compare and contrast non-modifiable and modifiable risk factors that threaten health, and discuss the nurse's role in risk factor modification and changing health behaviors, analyze variables influencing illness behavior, and discuss the effect of illness on patients and families. And I've said this before, you guys, but always read your objectives first. Go through your chapter and then go back and read the objectives and make sure that you can fulfill these objectives. So the goal of the Healthy People documents is that they identify leading health indicators that are high priority issues in the United States. This is the Healthy People 2030 goals. The government comes up with these goals, and how they achieve this is they really push for education in all these areas. For an example, we have here that the Healthy People 2000 demonstrate that infant mortality rates had declined because of the increased education about infants sleeping in beds with parents and in cribs with blankets. And also child immunizations had risen since that document, and deaths from coronary heart disease and strokes had declined. Now, they just use a lot of education to help promote these goals and work towards them. When you go through your slides, there is a document, or there's a link here to your document, or you can Google the Healthy People 2030 goals. I would go ahead and just take a look at these to make sure you understand just what we're trying to achieve here. And you can start seeing evidence of these goals being reached for when you see sometimes you'll see billboards talking about prenatal care, or billboards talking about health promotion in different ways. So we really need to look at the patient as a whole when we define health, and understand that each person is going to define it differently among their age group, gender, race, cultures. But when we look at health, we're not just looking at them physically, but we're looking at the physical, mental, social, and spiritual aspects of that patient. These things are all going to define health for that patient. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or an infirmity. So we're going to talk a little bit about health models. And make sure as you do your reading, you guys, that you really understand the health models and the different health models, because they will keep coming up. So why do we develop health models in the first place? It's to understand our patients' attitudes and values about health and illness so that we can really provide effective care. So what is affecting their health when they think about what is health? And how does that affect how we're going to communicate with them, how we're going to treat them, how we're going to encourage health promotion for them. So the health belief model suggests that a person's belief in a personal threat of an illness or disease, together with the effectiveness of the recommended health behavior or action, will predict the likelihood the person will adopt the behavior. So if that's the case for your patient, and they do have something serious going on, but they have no understanding of how serious it is, it would be your job as a nurse to educate them on the seriousness of their disease or their condition so that they can change or adopt a new behavior. The health promotion model focuses on the understanding that each patient has a unique personal characteristic and experience that affects their actions. So one example that we have here is a patient might quit smoking cold turkey because their father died of lung cancer. So what we're saying is that that experience is affecting their behavior. So each person would then have their own experience which can affect their behavior. And it could be effective in a good way, like they want to have do something for their health, or it technically could also affect health in a bad way. Their experience could say, well, my father smoked forever until the day he died at 103, and he was just fine. So it's dependent on each person's experience. So once we know each person's experience, we can help the patient understand what they can do to have better health promotion. Just something that kind of rings true to them. Like I said, is just based on their experiences. And if we can just work within those parameters, then we can make them understand why health promotion is so important. Here's a picture of the basic human needs model. So if we don't have our basic needs taken care of, like food, water, warmth, and rest, we can't really move on to seeking and working towards security and safety and belongings and love and need. And in the same sense, if we have a patient who's very sick and their ABCs, airway, breathing, circulation are not met, we cannot move on to things like self-esteem needs and self-actualization. Our basic needs need to be met first. So the holistic health model is known as complementary or alternative medicine. It promotes optimal health by incorporating active participation of patients in improving their health state. So it really uses anything that helps the patient, such as like music therapy, relaxation techniques, therapeutic touch, and guided imagery. Whatever helps the patient become their best healthy self will be used and for this health model. Here's a quick practice question for you guys to take a look at when you go through the slides. Okay, so let's look at some health beliefs that can negatively or positively influence health behavior or health practices. These are split into two types. We know them as internal and external variables. We're going to start with internal variables. Some of the internal variables that would affect health beliefs would be the patient's developmental stage, intellectual background, perception of functioning, emotional factors, and spiritual factors. Now, when we talk about external variables, that's things like family practices, social determinants, and their culture, the culture that the patient comes from. So for family practices, is this a family that has always done their well child checkups? Are they being seen when they're sick? If so, it's more likely that this patient will continue those behaviors when they're older. They will also go and still get their well checkups and be seen when they're sick. As far as socioeconomic factors, does the patient have health insurance? Can they pay their bills, or is that their primary concern? And then, of course, for culture, what are the beliefs and the customs of that culture? These are all things that can externally affect a patient's health belief. Another little practice question for you to take a look at when you're going through your slides. Okay, we're going to look at health promotion, wellness, and illness prevention. Our job as nurses, you guys, isn't strictly to take care of just sick people. We really want to catch this before the people are sick, right? We want to really play up on illness prevention. We want community health. That's why we have this whole Healthy People. we want to prevent those illnesses. We want to become better as individuals. We want to become more healthy as a society, and we need to become more healthy as a country. So you're going to need to know the 3 levels of prevention: primary, secondary, and tertiary. So primary being prevention, it's going to be like health screenings, nutritional programs, immunizations, hearing protection in occupational settings, training to develop good body mechanics. When we talk about secondary prevention, we're talking about preventing the spread of a disease, illness, or infection once it occurs. Our activities are going to be directed at the diagnosis and prompt intervention, thereby reducing the severity and enabling the patient to return to a normal level of health as early as possible. Tertiary prevention is when the defect or disability is permanent and irreversible. What we're really doing at this point is directing all our care at preventing complications and further deterioration. Another practice question for you to take a quick look at when you go through your slides. Okay, so when we're working with a patient, it's really important to understand that individual's risk factors, because they're just simply not going to be the same for everybody. And these risk factors are going to be split into modifiable and non-modifiable. Modifiable are things like their diet, the amount of activity, rest, sleep, smoking, drinking, drug use. And our non-modifiable are going to be things like age, gender, genetic factors, and ethnicity. So when we look at something like, for example, age, what is something that can happen in someone who's older? And obviously they can't modify their age. So this can be something like cancer, dementia, Alzheimer's, BPH, things that come on later on in life. Okay, now we're going to talk about health behavior change. I want you guys to take a look at table 6.2 in your books. It talks about the 5 stages of health behavior change. So our first one here, we have pre-contemplation, contemplation, preparation, action, and then our maintenance stage. So the trans-theoretical model of change describes a series of changes through which patients progress for successful behavior change, rather than simply assuming that all patients are in the action stage. Another practice question for you guys to go through. Now we're going to talk about illness and how we define illness. So illness is a state in which a person's physical, emotional, intellectual, social, developmental, or spiritual functioning is diminished or impaired. Illness does not necessarily mean presence of a disease. It's if there's any diminishing in function or impairment to any of those things that we just stated. So of course we have acute illness, which is short, and then we have chronic illness, which is anything that lasts longer than 6 months. Okay, so let's talk about illness behavior. This is really how your patients interpret their symptoms. We're going to talk about internal variables. So if a patient believes that the symptoms of their disease disrupts their normal routine, they're going to be more likely to seek healthcare assistance than if they don't perceive it to disrupt their life at all. Now, when we talk about external variables, that's like a patient with visible symptoms, or even, for example, like a high fever. Someone with a high fever feeling terrible, and you're able to see that this person has a fever and they're feeling it, they're more likely to seek assistance than a patient with no symptoms, such as like things with just like maybe like minor fatigue or bloating or things that they can explain away. Last slide here. When working with a patient, we need to understand the impact of the illness that is having on that patient and on that family. So what kind of emotional changes and behavioral changes is it going to cause? What kind of impact is it going to have on that patient's body image, on their self-concept? What kind of impact is it going to have on their family roles and on the family dynamics? How is it going to impact this patient as an individual, and how does it impact their family? One thing to always keep in mind when working with these patients is that you're really dealing with them when they're at their lowest. So they really need their compassion and your kindness and your best care and understanding while they go through this disease.